South Korea, for the first time today, reported more than 400,000 new cases of COVID-19. With the fatality rate falling, though, the authorities are looking at lowering the classification of the disease and easing the distancing rules. Seong-woo has the details.
South Korea reported a new record high of 400,741 cases of COVID-19 on Wednesday, almost 40,000 more than the day before, raising the nation's total tally to over 7.6 million. With 164 more lives lost, the death toll has surpassed 11,000. The number of patients in severe or critical condition also reached an all-time high of 1,244. That figure is projected to shoot up to around 2,000 by the end of this month or by early April, after the Omicron surge reaches its peak this week or the next. Authorities say, however, that medical resources are being mobilized proportionately.
Assuming the peak of the surge lasts as predicted and we respond accordingly with the current system in place, we believe this wave will be the last significant threat in the nation's fight against the virus.
A sentiment echoed by Prime Minister Kim Boo-kyum, who, despite still stressing the need to get vaccinated, assured the public that the peak of the Omicron surge would soon come to an end.
Quarantine authorities should discuss with the medical community how COVID-19 as an infectious disease can be reclassified from its current grade of level 1 so that the virus can be medically dealt with in an ordinary setting.
As such, health officials are increasingly concentrating their time and effort on treating patients who really need it, the most vulnerable. Those with underlying conditions in their 50s have now been excluded from the so-called intensive management bracket so that healthcare workers can focus on patients in their 60s and those with weak immunity. Meanwhile, people hospitalized for different illnesses who contract the virus but show mild or no symptoms will now receive care in their regular beds, not in isolation. The government will announce on Friday changes to its antivirus restrictions before its current social distancing scheme expires on Sunday. Several options are being considered for what is to come into effect on Monday, including maintaining the current guidelines, relaxing them further to allow gatherings of 8 and restaurants to operate until midnight, or even lifting the rules altogether. Before authorities make a final decision, though, they'll be holding in-depth discussions with stakeholders, including related ministries, local governments, and of course, medical personnel and business owners. Seong-woo, Arirang News.